let's get the view from Labour now. I can talk to the Shadow Health Secretary, Wes Streeting. Mr Streeting, really good to talk to you today. Thanks very much for joining us, especially given how cold it is outside. We were talking about, aside from the football, the state of the NHS, strikes, the current state of the NHS, and you've written an interesting piece in the Sunday Telegraph today. You say that after the pandemic, there are no quick fixes for the NHS and that you're terrified by the state of it. What would Labour do first and why?
So at the centre of Labour's plans to make the NHS fit for the future is the biggest expansion of the NHS workforce in history, because unless we have the staff we need, we won't be able to give patients the timely access to care that they deserve. So that would be the biggest expansion of the NHS staff in history, doubling the number of medical school places, increasing nursing and midwifery clinical training places by 10,000, 5,000 more health visitors, and doubling the number of district nurses. And we would pay for it by abolishing the non-dom tax status, because we think that people who make Britain their home should pay their taxes here too. And this is a fair way of funding something that's desperately needed, because unless you've got a plan for the workforce, you don't have a plan for the NHS, and unfortunately that's the terrible situation this government has found itself in, and that's the difference a Labour government would make.
Your critics would say that abolishing non-dom status is something of a cheap shot to get at the Prime Minister and his personal circumstances. What is the evidence that it actually would bring in that money? Because some would say that actually the very wealthy will simply take the best advice and move themselves and their money elsewhere and deny it to the Treasury. And also that your plans, yes, you're talking about far more staff members, which would be enormously welcomed in the NHS. But, for example, doctors, getting more doctors through the system, this takes years and years. You're talking solutions that will help in 5 to 10 years' time.
So I'd say a few things in response. I mean, firstly, the figures we've used and the analysis we've used is independent, produced by academics at Warwick University and the London School of Economics. It would generate more than £3 billion. That's more than enough to cover the £1.6 billion that our package would cost. And as for these claims that people would just take their money and go somewhere else, why is it that when it comes to taxing the wealthy, it's always far too difficult, but when it comes to picking the pockets of working people with punitive tax rises, that seems to be the Conservatives' first and last resort? And look, we haven't taken this policy to single out the Prime Minister and his family, actually, but there is a case in point in 10 Downing Street, isn't there, of someone who was a non-dom, now pays their taxes here and hasn't left the country. And I think that would be the case in the vast majority of non-doms too. And while I understand that the Chancellor wants good relations with his next-door neighbours, who doesn't, I do think this is a fair way of funding a workforce plan, which Jeremy Hunt himself welcomed when Labour first announced it. And he said, and these are his words, the smart governments nick the best ideas of his opponents. Well, I'm saying this morning, Jeremy, you're welcome to nick Labour's workforce plan. We need to get our skates on recruiting the doctors and nurses and other staff the NHS needs. You're welcome to nick the plan. And in the meantime, Sophie, there are things the government can and should be doing right now to alleviate the crisis in the NHS this winter, whether that's using spare beds in the private sector so that we pay for people to get seen faster, so it's free at the point of use for them, but much quicker using that capacity available. Whether it's dealing with the pensions issues that see doctors leaving the NHS early, retiring early for no other reason than their pension rules create a financial disincentive to stay on, or whether it's actually just pulling their finger out, and even where they're trying to do the right thing, like the £500 million to deal with delayed discharge in social care. Do you know not a penny of that money has hit the front line yet? Why? Because of all the chaos we saw over the summer, changing from health secretary to health secretary, from prime minister to prime minister. I'm afraid the Conservatives' incompetence and chaos is costing the country dear. But there are things they can and should be doing. We're calling on them to take that action. But ultimately, I think it's clear now after 12 years that the longer the Conservatives are in power, the longer patients will wait.
You're talking about the Conservatives nicking your ideas, but looking at this piece that you've written, it seems like you're nicking a lot of theirs. You've just referred to using the private sector more. Some would be astonished at seeing this policy coming from a Labour politician. You've also talked about the BMA, who we are going to be talking to later on in the programme, as vested interests. You say that they see you as a heretic for wanting better patient access, and you're going to take them on. How do you think these lines will go down with traditional Labour voters?
Well, the last Labour government successfully used the private sector to bring down NHS waiting lists. And, you know, by the end of that Labour government, use of the private sector had fallen dramatically because the NHS was so good that people didn't feel the need to go private any longer. And as for the question of values, I think it's outrageous we've got a two-tier healthcare system in this country today, where those who can pay to go private do, and those who can't afford to go private are left behind. Or indeed, there are some people that are scrimping and scraping, even getting themselves into debt in order to get seen faster. That's not a fair and equitable situation. That's not the NHS living up to its founding principles. And I think it's the right thing to do to create a level playing field, using empty beds in the private sector so that people can be seen faster. And as for the BMA, I mean, I was just responding in that interview with The Telegraph to criticism they levelled at me, because despite the fact that I announced the biggest expansion of NHS staff in history, because I had the temerity to say that we should also expect better service for patients in exchange for that investment, because I think that it's unacceptable that people have to wait on the phone at 8 o'clock in the morning to get through to GP. I have been treated like some kind of heretic by the BMA, and I'm afraid, you know, I do understand the pressure that doctors are under. They do a very difficult job against very difficult backdrop. But what I'm saying is, if we're putting investment into the NHS, as the next Labour government will, we have got to expect better results for patients. And ultimately, it's my job to be the patient's champion. I'm a patient myself. I've had great experience on the NHS. I've also had not great experience on the NHS. I want to make sure that everyone in this country gets a great experience and that we've got an NHS that's fit for the future.
But as the man who could very soon be Health Secretary, it doesn't sound like you've got a really great relationship from the start with the doctors' unions.
Look, I'm always willing to engage with the BMA. In fact, on the doctors' pensions issue, where they've made a reasonable point, as they did on that issue, I'm prepared to run with it. But what I'm not prepared to do is just accept lower standards for patients, because people think that it's unachievable to expect that people should be able to book a GP appointment online or see the doctor they want to face-to-face, get faster treatment. Now, I do understand the pressures that are on NHS staff today. That's why we're proposing to dramatically increase NHS staffing numbers. That's why on issues like retention of the staff we have, we're both urging the government to act on doctors' pensions, but also urging them to be grown up and get around the table with the unions that are preparing to go on strike, who even at this 11th hour are saying there is a deal to be done. I mean, the Royal College of Nursing and Unison have said just last night that if the government is prepared to sit down and talk about pay and all of the other issues, they will suspend strike action this week. Now, I think that is an offer that is too good to refuse, and I want the government to explain why they're not prepared to sit down and even talk, even though they know that patients will experience real disruption as a result of strike action.
Well,
patients will know who to blame. It'll be the government that's responsible.
We spoke to James Cleverly a little earlier, and he said that the Health Secretary's door is open, but that it's up to the independent pay review bodies to make a ruling on pay. You also said in this piece that the NHS is a service.
But the government's line's a joke on that, Sophie. The government's line is a complete joke on that. There hasn't been a single minute of negotiation. You've got the General Secretary of the Royal College of Nursing and the General Secretary of Unison saying they will suspend strike action this week if the government will talk. They've not even said if the government, rolls over and accepts the entirety of their pay demand. They have said very reasonably, if the government talks, we'll be there and will suspend strike action. It is completely unreasonable for the government not to want to negotiate. And I think they are spoiling with a fight. I think they don't have a plan for the NHS this winter. They're quite happy to see paramedics and nurses go on strike, because when the proverbial hits the fan this winter, they are going to blame nurses and paramedics for an NHS crisis which is squarely the fault of a Conservative government and 12 years of mismanagement. I think that's dangerous. I think it's reprehensible. I think it's irresponsible. And I think patients will rightly blame the government, not the unions, if these strikes go ahead.
OK, well, let's talk money then. What pay rises would the Labour Party give NHS workers? Let's look at the NHS itself. There are 9 bands in NHS pay, as I'm sure you know. Let's look sort of in the middle, band 4-ish. A theatre support worker, this is the person that holds your hand when the anaesthetic's going into your arm, make sure that you're all right, make sure the surgeon has all the tools that they need. They're currently on around £24,000 to £26,000 a year, which is about £12 to £13 an hour. What would Labour give them? What do you think would be a fair pay rise?
So we would be willing to negotiate, Sophie, and negotiate on pay, the wider terms and conditions, and the way that the independent pay review body works. I'm not going to pluck numbers out of thin air this morning, not least because a Labour government, after an election that's probably going to be in around 2 years' time, will have to judge the situation as it is then. And I don't want to create hostages to fortune.
The government shouldn't be doing.
No, I don't want to be misunderstood on that point, Sophie. What I said is that we would look at how the pay review body works, because when I have been talking to the RCN, Unison, GMB and Unite, they raise a whole range of issues, yes, around pay and the terms and conditions that staff are working under, which I think are intolerable. But they've also talked about the independence of the pay review body and the way it works. I'd be willing to look at all of those
scrap the current
issues,
system.
Engage seriously.
The pay review body system. Do you think it's up for review?
I'd be willing to amend. No, it's important that we have independent pay review bodies, and I think the unions have raised some legitimate concerns about how they work. I'd be willing to look at that. But what I'm not prepared to do, Sophie, this morning is to create hostages to fortune, and worse still, make promises for 2 years' time that I may not be able to keep, because when I come on your programme and say the Labour Party will deliver the biggest expansion of NHS staff in history, it's because I can guarantee what it would cost, how we would pay for it and the decision it would make. That's the approach we're taking to all of our policies. And sometimes I know it's frustrating for people who want us to go further, faster, for all of the campaign and lobby groups who want us to adopt this policy or that policy, but the Conservatives have crashed the economy. The public finances are in a real mess. And I want to make sure, as all of us in the Labour Party do, that when we go into the election, the public can have confidence that we can keep the promises that we make. So my message to the government today is get around the table with the unions. You can avert strike action. The unions are being entirely reasonable on this. Negotiate today, avert strike action, and we'll be willing to talk to the unions about how we make sure that the staff who are currently in the NHS feel valued, how we get the economy growing again so that we can invest in our public services and improve people's pay without having to resort to higher taxes as the Conservatives had, and to work together to reform the NHS so that it's fit for the future.
OK, we're nearly out of time, but I just wanted to ask you a little bit about the relationship between the Labour Party and the unions. We've had further allegations this week about the Unite union, 2 reports being handed over to the police from its own review into what happened there. When you look at the allegations that there are, do you think it's time for the Labour Party to step back from the way it is funded, relying on the unions for so much of its funding? Do you think it is time to think again about how your party is funded?
Well, 2 things. Firstly, I think the current General Secretary of Unite, Sharon Graham, deserves enormous credit for being willing to open the books and go through them, call in the investigators to make sure that her members' subs are properly used. And I think the findings we've seen are deeply worrying. But, you know, it takes guts to uncover the levels of wrongdoing that appear to have taken place in Unite, and I think she deserves credit for that. The second thing is the Labour Party was founded by the trade unions to stand up for the interests of working people. That, throughout our history, I think has been a strength. We don't always agree. We can't always say yes to every demand that the trade unions make. But I think what the trade union link has done throughout Labour's history is root us in the experiences and the interests of ordinary working people who, without the Labour Party, would not have a voice in British politics, because, as the Conservatives have shown us throughout their history, they act in the interests of a privileged few at the top. The Labour Party exists to serve the interests of the many. That's the fundamental dividing line in British politics, and that has never been more true than it is today.
OK, Wes Streeting, very good to talk to you. Thank you very much.